Welcome to the Explainer. Today we're decoding something absolutely crucial, life-saving protocols for drowning emergencies. You know, when someone's in the water and in real trouble, panic usually takes over, and not just for the victim, but for everyone standing around watching. The difference between a complete tragedy and a saved life really just comes down to knowing exactly what to do when seconds count. In this explainer, we're going to lock some incredibly simple, highly effective visualizations into your memory. That way, if you ever face this kind of high-stakes emergency, your training will just automatically kick in. Here is our agenda for today. 1. The anatomy of drowning. 2. Rescue using reach, throw, row, go. 3. The golden rule. 4. Not breathing and the Air Force technique. 5. Breathing and the log versus football trick. And 6. A summary to save lives. Section 1. The anatomy of drowning. What actually happens under the surface? To start off, it's really fascinating to realize that the body's very first reaction is actually trying to save itself. When water hits the airway, it triggers this sudden, violent, protective reflex called a laryngospasm. The vocal cords literally spasm shut. Now, this temporarily stops water from entering the lungs, which sounds like a good thing, right? Well, the fatal flaw in this biological defense mechanism is that it also completely shuts off all oxygen from getting in, and this rapidly leads to a severe lack of oxygen, which is known as hypoxia. So this triggers a rapid, chronological chain of events. Understanding this timeline is a real game changer. First, that laryngospasm blocks the airway. Second, the resulting hypoxia starves the brain of oxygen, and that quickly leads to a loss of consciousness. Third, once the victim goes unconscious, well, that spasm finally relaxes and water just floods freely into the lungs. Fourth and finally, without oxygenated blood pumping through the body, cardiac arrest follows. Our entire goal in first aid is to interrupt this chain as early as humanly possible. Section 2. Water rescue. Reach, throw, row, go. To interrupt that drowning chain, we have to safely intervene. But listen, the absolute first rule of water rescue is to not become a second victim yourself. That brings us to a super easy memorization trick. Memorize these 4 steps in exact order. Reach, throw, row, go. First, reach. Keep your feet planted firmly on dry land and extend a long object like a branch, a towel, maybe a fishing pole for them to grab and then pull them in. If they're too far out, step 2 is throw. Toss a ring buoy, a life jacket, literally anything that floats directly to them. Step 3 is row. If you can't reach or throw, use a watercraft like a boat or a paddleboard to get out to them. Finally, step 4 is go. Actually, scratch that. You only swim out to them as an absolute last resort. You should only go if you are a trained lifeguard, and even then, you must bring a flotation device to put between you and the victim so they grab the float, not you. Section 3. The golden rule. What not to do. Okay, so you've successfully and safely retrieved the victim onto dry land. Before we even check their breathing, there is an absolute golden rule you have to remember before doing any first aid. You must absolutely never try to physically squeeze, press, or pump water out of a victim's stomach or lungs. We've all seen those old movies, right, where the hero pushes on a drowning victim's belly to get the water out. In real life, doing that is incredibly dangerous. Here's why. When you push on a victim's stomach, it basically acts like a pump, violently forcing swallowed water and food right back up the esophagus. This causes the victim to vomit. Now, if the person is unconscious, they don't have a gag reflex, so that vomit is going to go directly back down the windpipe and into the lungs. This is called aspiration, and let me tell you, it can be immediately fatal. So remember, leave the stomach alone. Section 4. When breathing has stopped. The Air Force technique. Let's tackle the critical scenario where you assess the victim on land and they aren't breathing. You've got to get oxygen into their system right away. To understand how to do this, picture the lungs' tiny air sacs, the alveoli, like a wet sponge. You can't just tip the person over and pour the water out of their lungs like a pitcher. The sponge holds onto the water. Instead, you have to use positive air pressure to literally push the fluid out of the way, forcing it aside so oxygen can actually enter and absorb into the body. Think of this specific CPR protocol as the Air Force technique. For both adults and children who are drowning victims, you always start with 5 initial rescue breaths. Think of these 5 breaths acting like a bellows, forcefully pushing oxygen right through those thin layers of water in the lungs. Next, you move to 30 continuous chest compressions. This physically squeezes the heart, acting as a manual pump to drive that fresh, oxygenated blood straight up to the brain. After that, you follow up with regular rescue breathing and just keep up the cycle of 30 compressions and breaths. You repeat this relentlessly until they wake up or until paramedics arrive with mechanical ventilators to handle the fluid.
Section 5, if victim is breathing or vomiting. The log and football.
But what about the alternate scenario? What if you pull them from the water and they're already breathing? Or what if they suddenly start breathing on their own during your CPR? Or they start throwing up water? In this case, you don't force air in. You need to clear the airway using gravity. And your visual memory trick here is the log versus the football, which depends entirely on how big the victim is. First up, for adults, we use the log roll. I want you to imagine the adult's body is a heavy, stiff wooden log. Keep their head, neck, and torso perfectly aligned in a straight line, and just roll them entirely onto their side into the recovery position. The why behind this is all about gravity. By turning them onto their side as one solid unit, gravity will naturally pull any vomit and water out of their mouth and onto the ground, keeping their lungs completely clear. Now, for kids and infants, we use the football cradle. Picture holding an American football tucked tight against your forearm as you run down the field. You just pick the child up and rest them face down along your forearm. Gently support their jaw and chin with your fingers, making sure you aren't blocking their airway, and angle your arm so their head is slightly lower than their chest. Just like with the adults, this safely uses gravity to drain the fluid, but it gives you way better control over a tiny body.
Section 6, summary to save lives. Let's remember the tricks.
We've covered a lot of ground today, so let's lock in your definitive rescue toolkit. Number 1, rescue safely. Remember reach, throw, row, go. Do not become a second victim. Number 2, the golden rule. Never press on the stomach. Number 3, if they aren't breathing, use the Air Force technique. Picture that wet sponge and force oxygen in, with 5 initial breaths followed by 30 compressions. And number 4, if they are breathing or vomiting, let gravity do the work. Use the log roll for adults or the football cradle for infants.
In a terrifying emergency like drowning, raw panic is your absolute worst enemy. But knowledge is power. These simple visualizations, reach, throw, row, go, the wet sponge, the log, the football, these are the exact mental tools that bridge the gap between helpless panic and confidently saving a human life. The information is yours now, so here's my final question for you. If the unthinkable happens tomorrow, will you be prepared to step up when seconds count?